Doc Talk is brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there and welcome to Doc Talk. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and we're really glad that you joined us. We're going to have Dr. Gretchen Grissett, who is a veterinarian here at the Veterinary Health Center, talk to us today about urinary obstruction in goats. It's bound to be a great show, so stay tuned.
We started using Multimin about 4 years ago. We started out first in our own cow herd and our own replacement heifer program just to see how it'd work, experiment with it. We don't like to put a new product out there with our clients unless we've tried it ourselves or there's a lot of data behind it that we like. We had really good results with it our first year, really are happy with the way things worked. So we decided to start using it in our clients, and we have been now for 3 years, and I would say 90 to 95% of our clients use Multimin.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Welcome to the show.
Thank you.
Well, it's great to have you here, Dr. Grissett, and Dr. Gretchen Grissett is joining me today. She is a doctor of veterinary medicine, and she works here at the Veterinary Health Center at Kansas State University over in our food animal side. And we're going to talk about urinary obstruction in goats.
Yes, sir.
And, let's just start out with, what is this?
So, urolithiasis, as we commonly call it, same thing as bladder stones in humans and people. Basically, they're exactly what they are, is they're stones formed of different minerals and concretions and those sorts of things. They end up causing a variety of problems and issues for these guys, but they'll actually either obstruct their urethra, so they obstruct their ability to urinate, or can cause some other problems. Typically, so the ruminant, whenever they were designed,
Right.
The anatomy was kind of, I'm not exactly sure what they were thinking, but they have a very narrow urethra and ends up kind of predisposing these guys to getting an obstruction. They're the two main sites in goats and sheep mostly. They have the urethral process or vermiform appendage that hangs off of the urethra itself on the end of the penis. And when you look at that, that's just a few millimeters in diameter. So it wasn't really designed very well whenever God made these creatures. That's a common site to obstruct. And then also their penis has the sigmoid flexure, and so it makes this big S-shaped curve that's another site that they'll commonly obstruct out there. But for the most part, it's forms from different things that they're eating in their ration, those sorts of things that can cause stones. They can also be on certain pastures that are going to make them at risk, such as calcium oxalate stones. You can get on different pastures that have a lot of calcium or silicate and have stones of that form. But for the most part, it's usually a result of what they're eating in their diet.
So these two big places that they can, they're kind of two reasons. One, their anatomy lends itself to stone formation, but then the diets and the different production practices that we put these animals through, we're kind of putting them in a place where we're going to see these urinary obstruction where they can't urinate, and for people out there, like kidney stones and things like that, and the human side of things can be somewhat similar, but this one's actually stopping urine flow. And
they can get kidney stones as well. They can actually form there, but probably the most common sites is going to be on those two different sites that I mostly talked about. And then you can kind of see it in kind of, as you're saying, in the production species, they're these guys, they're feeder lambs or feeder goats, and they're pushing these guys to go to market.
Maximum performance.
Right, exactly.
Not watching the calcium phosphorus ratios,
correct.
Things like that.
And then you also have the other scenario where goats have become very popular as pets. And they're cute and they're fun to play with and feed, and so people can kind of overfeed them and predispose them to these issues as well.
Awesome. Well, this is a great topic. I can't wait to get into more with you. And we're going to be right back with Dr. Gretchen Grissett talking about urinary obstruction in goats. You're watching Doc Talk, and we're really glad that you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University, and I'm joined by Dr. Gretchen Grissett, who's a veterinarian at the Veterinary Health Center here at Kansas State University's College of Veterinary Medicine. We're talking about urinary obstruction in goats, and so we've talked about why we have them because of the anatomy and the production practices that we put these animals through that can help create these situations. But what are some of the things producers should be looking for as far as obstruction, or what are the clinical signs?
Okay. So early on in the disease course, you can they're not really specific signs. The goat just may be off a little bit, a little depressed, a little anorexic, a little off feed, not eating, not coming up to the bunk like you normally would. And then as it further progresses, or the animal actually will obstruct, they will vocalize quite frequently. And when I say that, it's because they're trying to strain to urinate, so they're vocalizing quite frequently because it hurts and they can't urinate. Their bladder's big, it's just like us. We got to go, and they can't, so they physically can't. And then you'll also frequently see these individuals, they're posturing to urinate. They're constantly kind of camped out with their back legs, just trying to go and vocalizing. And then from there, it can kind of go several different ways.
Okay.
So they can be blocked, and hopefully you catch it at that point in time and you bring it to us. Mm-hmm. And they're just going to be straining and they can't urinate, and that's fine.
This is an emergency situation?
Oh yeah, definitely.
Okay.
As soon as you notice signs like that, you need to be calling your local veterinarian and be getting on the phone with them.
Gotcha.
You have one way where you can actually rupture the urethra, and that can be anywhere along from inside of where it's exiting the bladder, or anywhere along that pathway.
So the urethra is from the bladder to the end of the penis?
Correct.
Okay.
Correct. So, if that happens, typically what'll happen is they'll get a lot of swelling on the bottom side of their belly. We call it edema. But you'll see it can be kind of mostly on one side. It can go from, their testicles up to their sternum, or, Is
that the old term water belly, or?
Yep.
Kind of get that look?
Yeah, kind of.
Okay.
But yeah, they'll certainly get a lot of edema. And so, usually when I see that, I think, well, the urethra's ruptured, and there's ways we can go about treating that. Then the next scenario would be they can actually rupture their bladder. And then that's kind of where they'll say the water belly term as well,
okay,
too.
Yep.
And then, when you do that, usually they're not vocalizing, but then at that point, these animals are getting very sick. That urine's not supposed to be inside of your abdomen. So
right.
These guys will be very depressed if you let this go on for a couple days. Once you get to that point, there's things that we can do, but obviously it's not an ideal situation if you have urine in your, yeah. And then you can also have points where it can, as we mentioned earlier, obstruct in the kidneys or the ureter, which connects the kidney to the bladder. And you can even pop, ureters or kidneys and those sorts of things, which is going to end up with the same scenario. You're going to have urine in your abdomen, and suboptimal for the animal for sure.
So let me refresh these. We can have the animal blocked and they're straining, rupture the urethra, rupture the bladder, or actually rupture the ureter or the kidney.
Correct.
So the big thing is recognize it early.
Right.
And
certainly, the earlier you recognize it, the better off it's going to be, and the more options that we have to have a successful outcome in treatment.
Great. Well, the next place we're going to go then when we come back from break is talk about these treatments and what Dr. Grissett and other local veterinarians would recommend if you have a blocked goat. We sure appreciate you watching Doc Talk. We're going to take a break here for a minute and we'll be back.
This tip brought to you by Batril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Batril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi folks, it's Dr. Dan from Doc Talk. Thanks for joining me for today's On the Farm tip. We're going to talk about extra labeled drug usage. Labeled drug usage is when I pick up the bottle, there's a label on it. And when I look at the label, it's going to tell me how much to give, how often, and the route of administration. Route of administration might be sub-Q, IM, or intravenous. Now, anytime you change the route of administration, or if you change the dosage, or you change the time in which you give those drugs, that's called extra label drug usage. We can't do that without the written consent of a veterinarian. So we need to follow label directions. If we don't follow label directions, we can wind up with antibiotic residues in the meat. And so when we do an extra label drug usage, we need the veterinarian involved. Thanks for watching today's On the Farm tip. I'm Dr. Dan, and I'll see you down the road.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
I'm Dennis Tebow. My wife and I, Kathy, are the owners of Wolf Creek Cattle Company. We have grown to approximately 70 bulls.
I'm Reese Arnold. I'm the livestock manager at Wolf Creek Cattle Company. These are not just like normal cattle. These cattle, they're hauled anywhere from, 8 to 10 hours a day across the United States and asked to perform. The Multi-Man 90 keeps them kind of level. It maintains and balances their system. The stress level's less when, when everything's right and working right, then they're working right.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
This segment is brought to you by the Graham School for Cattlemen, with over 100 years of continuous service to the cattle industry. To find out more, visit us online at grahamschool.com.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Gretchen Grissett. And both of us are here at the College of Veterinary Medicine at Kansas State University. And Dr. Grissett is a DVM, Doctor of Veterinary Medicine, over in the Veterinary Health Center. And today we are talking about urinary obstruction in goats. And we've talked about the causes, we've talked about the reasons why, some of the things that can happen. We need to get that goat to a veterinarian immediately. So I bring my goat to you. What are we going to do?
Well, first and foremost, Dr. Dan, probably what I would recommend in any case, in any scenario, is your variform appendage or urethral process that I talked about earlier, that little part hanging off.
Yep.
Usually we'll amputate that. That's one of the more common spots.
Okay.
Easy to do, obviously. Pretty easy to amputate, but probably your success rate is going to be 1 in 10. And even if you do that and it works, they're probably going to re-obstruct. So, first and foremost, I'll try that. If nothing else, I can at least give the goat some relief pretty quickly and make him a lot happier and a lot more comfortable. And then I kind of place it into kind of two big categories. If you've got a very valuable ram or buck or something of that sort that you're wanting to salvage his ability to breed and those sorts of things. Or if it's a valued pet and you want to make sure that this animal is going to live and have a nice long life, then I'll usually go ahead and recommend a tube cystostomy. So that's a big fancy word.
Explain that.
All right, so that's a big fancy word for basically saying we surgically go in and we place a tube inside of the bladder and then have the urine diverted outside of the body until we can get the stones to acidify that are in the urethra, which is what's allowing the animal to urinate. And then you leave that in there until you can kind of get that problem taken care of, let everything heal up, and then you remove that tube, and then ideally the animal should be able to urinate.
Gotcha.
So
you're just rerouting the urine until you can break up the stones or the obstruction in the urethra, and then you put them back on the...
Because most of these stones, they're about the size of sand. So, it's not like you can just go in there and roto-rooter it out, basically. It takes a little bit of time to be able to get those stones to clear and do them with the least amount of pain and complication for the animal as well.
So what if this is a meat goat?
So if this is a meat goat, I'm going to say, okay, well, let's get him patched up and let's get him sold. And then that's the case, I'll usually recommend doing something that we call a perineal ureterostomy, or a PU.
Right.
So that basically is a big fancy word for, we'll actually basically put a hole in the urethra kind of just below the anus. So, and basically they'll kind of pee like a girl.
Okay.
So we're hoping, and usually it is, the obstruction's going to be farther down from that, and they can, urinate out the back end.
Gotcha.
Now to do this, the urethra is kind of tissue that you irritate it, make it angry. It's not going to be very happy about that. So, you want to get these animals sold, because if you try to keep them around, they're going to have secondary complications such as a stricture and those sorts of things. If you do this, you can usually save the life of the animal, but it's kind of a patch and go kind of process.
More of a salvage,
right?
Meat goat type process in time to get them to slaughter.
Right.
Great. Well, we're going to take another break. When we come back, we're going to talk a little bit more about treatment, and then we're going to get to how you can prevent having urinary obstruction in your goats with Dr. Gretchen Grissett. You're watching Doc Talk, and we're sure glad you joined us.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
When a cattle producer has a mortality on their farm, it is very important to dispose of the animal properly. With Ag AM in Kansas, I'm Devin Stewart. A veterinarian with the Beef Cattle Institute talked about this in his presentation at a cow-calf seminar hosted by K-State's College of Veterinary Medicine. Dan Fries explains that the proper disposal of a carcass is extremely important for multiple reasons.
We can call a rendering truck and they come pick up our animal. A lot of times there is a small fee involved. One of the issues with rendering lately is increased regulation. We also have composting is a viable option and a legal option. We have burial is a legal option, and we have incineration.
With Ag AM in Kansas, I'm Devin Stewart.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noramectin line from Norbrook is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
Hi there and welcome back to Doc Talk. Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University with Dr. Gretchen Grissett, who's a veterinarian in the Veterinary Health Center. Sure been nice to have you here today.
I appreciate you having me.
And we're talking about the plugged goat or urinary obstruction. and happens quite frequently, but there are some things we can do to prevent it, right?
Right, there sure are. I guess first and foremost, what I'm going to talk about is nutrition. So obviously, if you've got a production goat herd, you know, you're trying to feed these guys as best as you can and get them ready for slaughter. So you're trying to put on that weight and feed efficiency and those sorts of things. Unfortunately, that's kind of the diet that really predisposes these guys to forming stones. So, you know, those high grain rations, that's actually with a lot of phosphorus in them, a lot of magnesium. Those are some of the big players that will precipitate stone formation. So automatically putting them on that kind of a ration is going to make them predisposed to it. Now I understand everybody's not going to stop doing those sort of production practices and get away from that. But you know, there are some things that you can do. You can increase the amount of forage or hay in that ration, and that way you can increase ruminations and that sort of stuff and kind of provide a different way for phosphorus to be excreted. It's usually, if it's not excreted through the saliva, it's going to be secreted through urine. So if you can do something to kind of provide a different way for that to be excreted, that's ideal. There's some other things that you can kind of do. Adding ammonium chloride to the ration can sort of help. I think they tend to recommend, you know, 0.5% to 2% of the ration to help those sorts of things. To basically, it's a urinary acidifier that will help.
It doesn't make sense to feed something that's kind of basic.
Right.
But it does acidify the urine
Correct.
and helps prevent those stones from occurring.
Right, correct. So there are options like that you can add to the ration. Even just increasing salt in the ration will help out a lot, because the more you drink, the more you're going to urinate, and you're going to dilute all those little particles like phosphorus and such in your urine.
So you add some salt to the ration, and then they drink more.
Right, and it'll help kind of dilute things out, hopefully, and it'll prevent stone formations. Cool. And then obviously, if you're in an area that's got, you know, silicate pastures or those sorts of things, obviously getting them off of those kind of predisposing pastures would be the ideal thing to do, but that's really not a problem that we're going to have here in Kansas. And then obviously, for the kind of the pet goat owners, I always kind of touch on is, you know, those guys, they're pets, they're there to look cute. You know, I would feed them mostly a roughage diet. And you know, people don't think about snacks. You know, I have people, they're feeding them honey buns and those sorts of things. But you don't think about it, that's sugar. So that's still going to predispose them to forming stones. So, you know, I do a lot of talking about diet, you know, and people want to say, well, I feed it strawberries. Okay, still sugars. You know, it's healthy, but you know, it still can potentially be bad for your goat. So, you know, I talk a lot about, you know, decreasing a lot of those snacks and treats and being sure that you get kind of goat-friendly treats and those sorts of things, or at least limit those down a little bit.
That's awesome.
So.
Don't eat the tin can, right, in the cartoon. Well, we appreciate you being here today and spending some time. It was a great show.
Thank you for having me.
And thank you for watching Doc Talk. Remember, if you want to know more about what Dr. Griss and I do here at Kansas State University, you can find us on the web at www.vet.ksu.edu. Remember to always work with your local practitioner. I'm Dr. Dan Thompson here from the College of Veterinary Medicine at Kansas State University. You've been watching Doc Talk. We appreciate you watching the show, and I'll see y'all down the road.
For more information about this program or previous programs, go to doctalktv.com. Doc Talk was brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Mike Davis, owner-operator of the Cooney Ranch, Southeast Oregon. We're running right at 700 head of mother cows. We've been using Multimin for about 5 years now. Here at the Cooney, we're selenium deficient, manganese, copper. I know those are three of the big ones that we are short on. And with the Multimin, I believe that it's helping to up that response. We all do a mineral pack. When we first put it out, they'll eat a lot of it. And as they get it built up in their system, they'll back off of it. The Multimin probably gives them an extra boost to get those other trace minerals going. We give the calves a shot of Multimin at branding, and then the calves will be followed up with another dose of Multimin in the fall when we wean. And then in the spring, before we turn out, we'll give the calves another shot. We give all the cows once a year, we give them a shot of multi-min when we process in the fall. The bulls, we process them in the fall too, and give them a dose of multi-min then. We try and get the bulls in again before we turn them out with the cows, and just give them a dose then, hoping to get a little better preg rate, efficiency out of the bulls. With our replacement heifers, because I'm trying to keep around 100 to 125 replacement heifers, so we'll give them a dose of multi-min before we turn the bulls in with them. Last year we were right at a 98% breed up. It could be a lot due to the multi-min. With multi-min use, everything's been better. Ease of calving, the milk rate, we've been doctoring less and less. Scours, especially, all the cattle are healthier. I feel that multi-min's well worth buying. I believe we're getting what we need back out of it.